This segment is sponsored by Cosmetic Surgery Associates. Cosmetic Surgery Associates is located in Bethesda, Maryland, and offers the latest in cosmetic procedures. So joining us today to tell us everything we need to know about a very popular eyelid surgery is board-certified plastic surgeon Dr. Frank Richards. Dr. Richards, good to have you.
Thank you very much. It's good to be here.
All right, so we're talking about an eyelid surgery. Why has this become so popular?
Well, it's become popular because we have an aging population, and we'll often have patients that'll come to my office and they'll want to look younger. They'll want to set back the clock a little bit. And they'll come in asking for a facelift procedure. But oftentimes, not only is maybe the face could use some work, but it's the eyelids where those can be causing the real aging features in somebody's face. And those are something that's just right there that people look at first. And so sometimes we can address the eyelids and really help patients get a younger look without having to do a full facelift.
Right. So you're talking like eyelids, but also bags too, right?
Right. So the eyelids, looking at the upper eyelid and also the lower eyelid, the usual concerns are that the upper eyelids have excess skin that can hang down even on the eyelashes, and then the lower eyelid, eye bags, fat deposits on the lower eyelid. That's really an aging feature.
Okay. And then for this procedure itself, what does that entail? I mean, you think of any kind of procedure, maybe it's a little scary or you don't know what you're going to look like afterwards. So can you kind of walk us through that a little bit?
Sure, absolutely. It is a surgical procedure. We do this in our office. To do the upper and the lower eyelids takes about an hour and a half to 2 hours. It's done under a local anesthetic with sedation. So patients are asleep, but it's not general anesthesia. They don't remember anything about the procedure, and there's no pain involved. So it's a sedation anesthesia, and the upper eyelid skin is removed through an incision in the upper eyelid crease, and then the lower eyelid fat is removed through an incision that's actually behind the lower eyelid.
Oh.
Now, after removing the fat, sometimes there's excess skin on the lower eyelid, so we make a small incision just right underneath the eyelashes where the eyeliner would be, and through that incision we remove the excess skin on the lower eyelid. And what that does is that opens up the upper eyelid, it gets rid of the hanging skin, and it smooths out the lower eyelid, and the bags are gone.
And you're not seeing the scars or anything that comes with it?
Correct. I mean, it does look a little surgical at first for a week or two, but after that, patients usually are back to work in a week or two, and you don't really see the scars at that time.
Okay. So doing this procedure, I know sometimes people get concerned about cosmetic procedures because they feel like they're not going to look natural.
Well, I'm glad you brought that up, because every single one of our patients that come in, that's their biggest concern, is that they want to look natural. So we use techniques that give a natural look and a natural appearance. We will never use a procedure or a technique that would give somebody an operated on look or a pulled or stretched look or a surprise look. That's just not something that we do, and we tell our patients that they can plan that that will not happen.
What do you see with your patients of how it makes them feel afterwards?
Well, oftentimes patients come in because they want to look younger. And certainly it does do that. But also there's self-esteem issues. There might be body image issues. There might be issues that they're concerned about. And I often talk about this as a social media anxiety, where they're on a lot of video conferencing being done now, and they look at themselves on the screen, and what they see on the screen doesn't match how they feel. And they might even have friends that tell them that they look sad or they look tired, and they don't feel that way. And so patients will come in and they're concerned about some of these issues, whether it's facial aging, where we'll do facelifts, or the eyelids, and we do the eyelid surgery, and sometimes that's combined together. But most of the time, patients come in because they don't feel they feel different than what's being perceived by others.
Right, and it gives them a chance to match on the outside how good about themselves they're feeling on the inside.
Right, that's exactly right.
I love it. Dr. Richards, thank you so very much. This is great information for you at home. If you want more information, you can go to cosmeticplastics.com or just give them a call, 240-868-6106.